This news from the Colts this morning may have caused some people to question the testing process, and that's on top of State Health Commissioner Dr. Christina Box's false negative test that she got earlier this week before testing positive. A lot of questions about some of these rapid tests today because of this. Fox 59's Melissa Crash is live in the newsroom to explain. Melissa, how do we know if a test, especially one of these rapid tests, is accurate?
That's right. That's a question many people have, especially after today's Colts news. This not only leads to confusion, but also hesitancy towards COVID-19 testing. So what should we believe? Now, I spoke with an expert from the Richard M. Fairbanks School of Public Health to help answer our questions.
A Colts COVID scare. In just a few hours, we learned the 4 people who tested positive for COVID-19 retested and now are negative.
That doesn't happen very often, especially around COVID-19.
Thomas Dazinski is the Director of Epidemiology Education for the Richard M. Fairbanks School of Public Health on the campus of IUPUI. He reports false negatives are more common and more challenging.
You could go and get tested today and be negative, and then get tested tomorrow and be positive, and you're thinking, well, what's going on here, right? The reality is you may not have enough virus yet when they do the nasal swab, right, to detect it on that test yet.
Dazinski explained that there are 2 factors that weigh a COVID test.
The sensitivity is if I truly have the disease, will the test be sensitive enough to say, yes, I have the disease? And then specificity is just the opposite. If I truly do not have the disease, can the test accurately say I do not have the disease?
And the type of test that could also impact your results.
From much of the research that I've seen is that the one that goes all the way up the nose, right, what we call a nasopharyngeal swab or an NP swab, is probably the most accurate now for detecting active infections.
Dazinski is aware of the hesitancy surrounding testing, but to keep all of us in the game, we have to take the proper steps.
We see people not getting tested because they don't have signs and symptoms, which then they are infected and infectious, and that represents a huge challenge for public health.
And we're still waiting to hear from the Colts organization on what type of testing was used for the individuals who originally tested positive. We'll, of course, keep you posted on what we learn. But for now, reporting live in the newsroom, I'm Melissa Crash, Fox 59 News.
All right, Melissa, thank you. All of these developments today as